Tonight, a major CDC investigation here in Oregon after a woman dies shortly after receiving the now on hold Johnson & Johnson vaccine. It is 10 o'clock. Good evening, everyone. I'm Jeff Gianolo.
And I'm Elizabeth Din. Health officials can't say where in Oregon the woman lived, and right now we don't know if she had any underlying conditions.
Our Jennifer Dowling spoke with officials with the Oregon Health Authority and has more on that investigation. What are they telling you tonight, Jennifer?
Well, the Oregon Health Authority is cautioning that it's too early to tell if there is indeed a correlation between the vaccine and the woman's death. But they say the CDC will be working over the coming days to determine if there is a link between the two.
The event was a rare but serious blood clot that the woman developed within 2 weeks following vaccination.
An Oregon woman in her 50s is now at the center of the latest investigation by the Centers for Disease Control and Prevention into the Johnson & Johnson vaccine.
I want to emphasize that at this time, we do not know whether the Oregon woman's death is related to the Johnson & Johnson vaccine.
OHA's Dr. Shimi Sharif says the woman's case appears to be similar to 6 others already under investigation nationwide.
Cases of the blood clot, known as a cerebral venous sinus thrombosis, has been identified in 6 women around the country between the ages of 18 and 48 who received the Johnson & Johnson vaccine.
The Oregon woman got the shot before the vaccine was paused nationally and in Oregon. Dr. Sharif says for others who are concerned, these are the symptoms to look out for.
A severe and unusual headache outside of a general headache that headache sufferers usually experience, in addition to certain symptoms like shortness of breath, stroke-like symptoms, abdominal pain or leg pain, which can indicate evidence of clotting in other parts of the body. In addition to that, some people with low platelets can present with small dots, noted as small microbleeds in the hands and the legs.
She says those dots would likely be red or brown. Dr. Sharif says the CDC's Advisory Committee on Immunization Practices is reviewing all the cases to weigh the risks and benefits of the vaccine.
The case count that we're aware of so far is only about 7 cases in a total of 7.5 million vaccinated across the country. Additionally, we do have to note that not all of the cases did result in deaths. This is, as to our recognition, the second death reported so far since the investigation began.
And Dr. Sharif says if the CDC does decide to resume the distribution of the Johnson & Johnson vaccine, then the Oregon Health Authority will likely follow that recommendation and do the same. Back to you.
All right, Jennifer Dowling live on this very big story. Thanks, Jennifer.